Welcome to OAC Health Talks. I'm Joe Naglowski, OAC's President and CEO, and we're excited for you to join us for this educational video series that dives deeper into specific health topics that we know are important to you and the OAC community. Today's OAC Health Talk tackles another important topic: signs, symptoms, and forms of post-operative addiction, featuring psychologist and certified eating disorder specialist Kelly Broadwater. Post-operative addiction is often overly simplified as transfer addiction or cross-addiction, assuming individuals trade compulsive eating for other compulsive behaviors. This health talk will help you understand how addictive processes occur after surgery by breaking down the signs, symptoms, and forms of post-operative addiction. And with that, take it away, Kelly.
Hi, and thank you to the Obesity Action Coalition for asking me to speak on the topic of addiction issues in post-operative bariatric patients. My name is Kelly Broadwater, and I'm a psychologist, licensed clinical mental health counselor, and certified eating disorder specialist who's had the privilege of working with bariatric patients for nearly 20 years now. One of my favorite parts of my job is seeing the amazing transformation and health and well-being that goes along with bariatric surgery. And kind of on the flip side of that, I've seen some pretty scary and tragic things happen related to post-operative addiction. So I'm happy to be able to educate and hopefully offer support and resources if you are struggling with an addiction. To start off with, just some general facts and figures about addiction in post-operative patients. We used to call it transfer addiction or cross addiction, and we've really changed our language around that because so many people have addictions newly develop after surgery. Now, some people may have previous addictions that reemerge or that they relapse with, but a great majority of people are developing new addictions after surgery. Alcohol and other drugs are what we most commonly think about with addiction and chemical dependency, but there are also process addictions or behavioral addictions, such as food addiction, compulsive shopping or spending, gambling, sex, skin picking, and even overexercise. For these behavioral or process addictions, over 30% had no previous history of these addictions prior to surgery. The most common addiction after surgery is actually alcohol, because both gastric bypass and gastric sleeve change the way the body metabolizes alcohol. So I'll spend a lot of time talking about that in this health talk and some of the medical complications that can go along with that. Then it's also important to note that the risk increases with your time out from surgery. So the further out from surgery you are, the more likely that an addiction may happen. So what are some of the risk factors for addiction after bariatric surgery? Now, just because you have some of these does not mean you will definitely develop an addiction, but I do want you to be aware of things to look out for. And if you have one or more of these risk factors, just really know that your vulnerability is increased, especially a family history of any kind of substance abuse or addiction. We know that about 50% of addiction is genetic. So just like with any other medical condition with a strong family history, you are more prone to it if you have that in your gene pool. So really being aware of that. Also, a history of eating disorder or food addiction, or a history of chronic pain, especially if you're using narcotics for pain management. That's something you'll probably want to talk to your medical team about more extensively, so that we prevent any issues with addictions to opioids after surgery. Regardless of whether or not you had bariatric surgery, a trauma history makes you more prone to addiction, especially a history of child sexual abuse. Any other psychiatric conditions also make you more vulnerable to addiction. So depression or other mood disorders such as bipolar, ADHD, or other impulse control disorders, post-traumatic stress disorder, other anxiety disorders. So there's a lot of comorbidity with psychiatric conditions and addiction. A lot of times, one's the underlying problem, and then the addiction becomes one of the symptoms of that problem. Not having adequate support or being isolated, we definitely saw that a lot during the COVID-19 pandemic, with the rates of addiction and overdose kind of skyrocketing, and unfortunately the bariatric population wasn't spared from that either. And then just some personality factors that kind of make you more prone to addiction is if you're a very avoidant person who doesn't like confrontation or conflict or dealing with things that are distressing, you may be more likely to use substances or behaviors to kind of escape. And self-sabotaging tendencies. If you have tendency to set yourself up for failure or make poor decisions that kind of lead to negative consequences. And if that's a persistent pattern, you might be more apt to develop addiction. So what are the signs and symptoms of addictive behavior? How do you know if what you're doing constitutes an addiction? I'm going to go through a pretty long list. A lot of these are actually diagnostic criteria, and then some of them are just things that we see, psychosocially that happen when somebody's dealing with addiction. Number one being the need for more and more of the behavior or the substance to achieve the desired effect. This is really the definition of tolerance. So maybe, one Xanax used to take the edge off, and now you need 2 to even feel anything. And then 3 is even better to really help you relax. That's kind of an example of building up a tolerance. Using the substance or engaging in the behavior for longer than you intended to, or in higher amounts that you wanted to. So again, that's needing more and more of the substance and, using more of it than you want to, and it taking up more of your time and energy. You might have a strong desire to cut back, but not be able to. So that's a really good indicator that the addiction has kind of gotten out of control and that you need professional help. If you're trying to cut back on your own and that's really not working, this isn't just a matter of willpower. Addictions are very complex neurobiological diseases and do require medical and psychological intervention a lot of times. Addiction really bleeds into all areas of a person's life, especially the more entrenched they are in the addictive behavior. So it'll cause problems for them socially, professionally, personally, financially, legally. I had a client who made a very comfortable income actually have to file for bankruptcy because of her compulsive shopping and spending. Or I've had another client lose custody of her children because of her addiction. So, it can go from small minor annoyances of problems to pretty catastrophic consequences, kind of depending on how entrenched the addiction is. Another warning sign or symptom, people making comments and complaining about your behavior or suggesting you cut back. Their confrontations may range from being really caring and concerned to being really annoyed and angry, and that can kind of be dependent on the relationship you have with that person or how much the addiction is interfering. So having other people notice and bring it to your attention and want you to change the behavior, which can then lead to sneaking or lying to cover up your behavior or the consequences of it. I've certainly had plenty of clients that I had a very strong therapeutic relationship with just sit and lie to my face about what they were doing in terms of their addiction, or not even tell me that they were struggling with one. So there's so much shame and secrecy involved in it. And so if you find that you're sneaking and lying more and more, that's a sign that the addiction has got a good hold and is out of control. Another sign of that is spending more and more time or money to obtain the substance or engage in the behavior, where it really kind of becomes very all-consuming in terms of your decision making of where you're going and what you're doing and who you're with. I've already talked about the feelings of guilt or shame about your behavior, and that can also lead to being very defensive or denying that you have a problem or even minimizing. So I've definitely had clients that when asked about their behavior will make it sound like it's no big deal. I had a client say, "Oh, I get a little fuzzy sometimes," when really what she meant was that she was blacking out every time she drank. And then the behavior of the substance becomes one of the main things you look forward to. It's really kind of overtaken your life and many different aspects of it. So I know that's a very long list of things that can happen with addictive behavior, but important to note and kind of check in with yourself about. So kind of with that defensiveness or denial, I've definitely heard people say, oh, I don't need to worry about that. First and foremost, I didn't have an addiction before surgery, so why would I develop one after? Especially with alcohol. So people will say, I was never a drinker before surgery. I don't need to worry about that. But that's actually not true, because more than half of the people who develop serious alcohol use problems following surgery did not have issues with alcohol prior to surgery, more than half. So just because you weren't a drinker before doesn't mean you're immune to developing an alcohol problem. Thinking that you're far enough out from surgery. Oh, I had that years and years ago. I'm good. I've dodged that bullet. But actually what we know is that patients who've been post-operative for longer periods of time are more vulnerable, especially to developing alcohol problems. We usually start to see, based on the research, the most problematic drinking starting around 2 years post-surgery. And there's research about substance use in general really peaking and skyrocketing from 2 years out to about 7 years out from surgery. And then another thing that I hear that's a very common misconception is that if they've had gastric sleeve, they don't need to worry about it because they don't think that that is as invasive as a gastric bypass, or that it changes the way alcohol metabolizes. But there's actually new research that proves that even with gastric sleeve, blood alcohol content increases faster, and the peak blood alcohol content is roughly 2-fold higher in patients who have bariatric surgery, whether it's gastric bypass or gastric sleeve. So what that means is that somebody who hasn't had surgery, if they drink 2 glasses of wine, their BAC is like they've drunk 2 glasses of wine. If you've had bariatric surgery and you drink 2 glasses of wine, it's more like 4 glasses of wine, the equivalent of 4 glasses of wine. So your blood alcohol content will go up faster, and you will feel drunk, more drunk than somebody who's not had surgery and drank 2 glasses of wine. And it will put you well over the legal limit. So just some things to be aware of. Kind of following along with that, like I said, alcohol is definitely the most common and potentially dangerous addiction because of the way bariatric surgery changes the way your body actually metabolizes the alcohol. A very interesting study out of Stanford assessed people drinking just 5 ounces of red wine. So 1 glass of wine, they looked at the effects of 1 glass of wine preoperatively, and then on the same patients 3 months postoperatively, and then 6 months postoperatively. And what they found was that their blood alcohol content, before surgery was well under the legal limit, and after surgery, 6 months out, it was over the legal limit. And the further out they were, the higher the BAC was, and the longer it took for their blood alcohol to get down to 0. So before surgery, those patients took less than an hour to get their blood alcohol content back down to 0, and for the body to metabolize that alcohol and burn it off. And then 6 months post-op, it was almost an hour and a half. So quite a bit of difference. Also important to note that liver disease develops about 5 times faster in post-op patients. So the impact of drugs and alcohol in the liver is dangerous for anyone, but much more so if you are a bariatric patient. And that kind of leads me into the next slide about different complications related to post-operative addiction, many of them being medically related. So people have weight loss surgery to lose weight, and so weight recurrence can happen, and that can be pretty devastating to folks. You had the surgery, they don't want to regain their weight back, and that is definitely something that we see happen in patients with post-operative addiction. On the flip side, depending on what kind of addiction they're dealing with and how entrenched it is, you also might see too much weight loss, which can become problematic in and of itself as well. You see dehydration and vitamin and mineral deficiencies. I've just seen some really terrible labs on patients afterwards that are dealing with different addictions, especially drugs and alcohol. Those behavioral process addictions aren't going to affect the labs as much. Ulcers. So this can become a real medical emergency to have an ulcer in your pouch or your sleeve. I've definitely seen patients in the hospital with perforated ulcers or necrotic ulcers that, that can be super dangerous or even deadly. I've already talked about liver enzymes being off. Pancreatitis. I had one patient who ended up in the ER with a really extreme case of pancreatitis, and based on her labs, the ER doctor actually didn't believe her when she told him that she was only drinking 1 or 2 glasses of wine a night. He was like, these labs look like somebody who's a raging alcoholic. So again, that just highlights how much more of an impact alcohol can have on someone who's had surgery. Chronic constipation, we see this a lot in folks with opioid, narcotic addiction. It really kind of shuts down the GI system, which can be, obviously problematic. Hypoglycemic episodes, so blood sugar spikes and crashes, especially with overuse of alcohol or with food addiction where somebody's eating high sugar content foods. You see a lot of issues with blood sugar. Poor sleep and mood changes, that happens with many addictions and is something that can be very distressing and problematic. High blood pressure. And then the last 3 are kind of the most serious. You have negative interactions with other medications, seizures, and even death. So I want to stress especially alcohol withdrawal and benzodiazepine withdrawal. So benzos are those anti-anxiety medications like Xanax or Klonopin. The withdrawal from those are the most dangerous and can cause death. So you definitely don't want to try to quit cold turkey or do it on your own. Absolutely seek medical supervision if you're trying to detox from alcohol or benzodiazepines. So what should you do if you think you have a problem? The first step is to admit it. That's actually the first step in Alcoholics Anonymous and Narcotics Anonymous and whatnot. But even notwithstanding being in a 12-step program, the first step really is to admit that what you are struggling with. Break the secrecy. Talk to someone you trust. Just let someone know. You don't have to be ready to change your behavior or to quit entirely or altogether, but just start talking to people about it. Definitely seeking professional help. There's tons of resources out there, and psychologists and therapists and counselors, substance abuse treatment programs, addictions counselors, eating disorder specialists. Seek professional help that is out there. Reaching out to others for support. So people who've been through addiction and come through on the other side of it and are in recovery and can be a support system. It doesn't have to be 12-step like AA or NA or Gamblers Anonymous or Sex Addiction Anonymous. There's certainly, that's kind of nationwide and very well known and available, but there's also something called Smart Recovery, which is more cognitive behavioral therapy based and has less of the spiritual component than other 12-step. And then on the flip side of that, a very faith-based recovery program is called Celebrate Recovery. It's a support network, a support group. One of the great things that did come out of the pandemic is much more access to meetings. So there's phone meetings and virtual meetings kind of all times a day, all over the world. I've had clients that worked night shifts, so they were sleeping during the day and needed meetings at different times that aren't traditionally held in your community, be able to call in or Zoom in on a meeting. So there's just so much in terms of resources out there for different recovery groups. And then definitely be sure to tell your doctor, your surgeon, other healthcare medical professionals. They need to know what you're dealing with so they know the appropriate labs to run and can be really medically monitoring you and keeping you safe. So I'm going to end today by talking a little bit about a patient of mine named Lily. That's not her actual name. I'm protecting her identity. Lily's actually my puppy's name. But this was a female who was in her 40s. I treated her for many years prior to her ever deciding to have surgery for binge eating disorder and post-traumatic stress disorder. She had a significant childhood sexual abuse history. She briefly drank in college, to the point of binge drinking, but had no concerns with her alcohol use because she really hadn't drank at all since college. And like I said, she was in her 40s. She had a gastric bypass and lost over 120 pounds, was very successful, very compliant with recommendations. We continued to do therapy for 2 years post-operatively. She did really well and graduated. So when she came back to see me several years later, she had severe depression, significant insomnia, anemia. She had had a couple of seizures, and she had some episodes of high blood pressure. So all of those major context clues of medical complications related to addiction, but she denied to me that she was drinking. And so it wasn't until she had an episode of high blood pressure that became a medical emergency and she became hospitalized did she finally become honest with both her primary care physician and myself that she was dealing with a very significant alcohol problem that had started as a result of insomnia. She was using alcohol to help her get to sleep, and then it kind of just spiraled out of control from there. She did have to go to inpatient treatment for her alcohol, but now she is proudly over 10 years sober, and she remained in therapy for many years and continues to this day to be involved in a 12-step recovery program and works with a sponsor. So, a very significant case that could have gone very wrong. Again, having seizures is a super dangerous indicator of how bad an addiction is, but somebody who's maintained over a decade of sobriety. So just know that it is possible, no matter how hard of an addiction you're dealing with, that it feels like it might be to overcome, that there is hope. I've had plenty of other bariatric patients with addiction and actually have even run groups for them. And these are some of the words of wisdom that they, when asked what would they say to other patients who are dealing with addiction. Join a counseling group. Don't try to do it alone. Be honest with yourself. Admit that you need help. Don't wait to seek help. And know that others have the same issues you have and you can learn from each other. So again, just really wanting to convey a message of hope. If you're struggling, it can seem hopeless, but definitely on the other side of that, there's a lot of recovery to be had. So we wish you well on that journey. And there are many resources. Obesity Action Coalition has them, and a lot of different online resources. There's a national helpline through SAMHSA, which is a government organization. And then obviously all the A's, Alcoholics Anonymous, Narcotics Anonymous, etc., have online web pages where you can find local meetings or even phone or virtual meetings. So no matter what, please make sure that you get the help that you need. I'd like to thank the OAC once again for asking me to speak on this topic.
Thank you, Kelly Broadwater, for providing us with such helpful information on signs, symptoms, and forms of post-operative addiction. The OAC has a variety of education opportunities for you throughout the year, but one of the best places you can turn to for quality, unbiased education is our resource library. Simply visit obesityaction.org/library to check out our brochures, articles, guides, videos, and more health talks. Also be sure to subscribe to our YouTube channel to get notified about any future educational events. Thanks for joining us.